Hi there, my name is Sonal Mehrotra Kapoor and you're watching me on NDTV. Now today we'll be talking about in this video something which has been hugely requested by all of you. We'll try and understand what has been the difference in the virus, in the COVID-19 from last wave to this wave. That means the strain in all its form in 2020 versus the various strains that have now come in the country. We will talk about if it's more deadly, more infectious, more infectious than how much really. All of those details we'll discuss over the next few minutes. First up, some basics. What exactly are the various variants that are in the country right now? So last year in 2020, we just had one India strain. Just for convenience, let's just call it that. They have a complicated name, so let's not get into those details. So we had an India strain, but this time we have a UK strain, a South African strain, a Brazilian strain, and then the double mutation India strain, something we've talked about in our previous videos as well. But the most important thing perhaps about these strains coming in is that the present cocktail of strains that is available in the country right now is making the virus very contagious. For example, in 2020, the India strain, if you were in a room full of 20 people and people were eating and all of that was happening, interaction was happening inside a closed door, around 6 to 7 people would have caught the virus. Cut to now, in this cocktail of strains in the country, in the same room of 20 people, same environment as well, some 15 people can get infected. That gives you an idea of how much more contagious it is. And that's why we're seeing a sudden rise and very quick rise in the numbers as well. Next up, something very important, I'm going to tell you the immune escape. Now, first let's just understand what that is. Infection despite antibodies, either acquired or injected, meaning if you've had COVID and you have antibodies, or if you've taken the vaccine and you have antibodies, the 2020 strain was not jumping it. But now, these new strains, at least the UK strain, more importantly than the others, is jumping that, meaning it is escaping that immune response. It will still give you a disease. Next up is vaccine efficacy, something that everybody wants to know about. So, 2020, we had all the vaccines up. So, say Pfizer and Moderna, which have the maximum efficacy, 95%. Sputnik, 92 almost. Novavax, about 89% or so. Now, all these vaccines with the current strains in the country are a little compromised. The most compromised they are against the South African strain. They simply are not showing enough impact on that strain. But having said that, do remember that all these vaccines, even the ones that are in the country right now, they all work to prevent you against death, to prevent you or minimize your chances of hospitalization. So it does not mean, when I say the efficacy is compromised, it does not mean that they don't work at all. It simply means that the level of protection is decreasing in presence of these new strains. It will still prevent you from death. It will still prevent you to a certain degree from hospitalization. So yet again, time to remind you that do get your vaccine whenever you get a chance. Next up, blood clots, something that is the conversation in all drawing rooms right now. When it comes to blood clots, in 2020, we didn't see any of these reports really come out at all. And when it comes to 2021 as well, right now also, I just at the outset want to say this, that the entire business of blood clots is extremely rare. There is no study that is backing it or linking it to a particular vaccine or talking about a phenomena developing against any particular strain. But there are a group of people or a section of people who have been identified who could be vulnerable, and these are women under the age of 30. There is a bit of a vulnerability when it comes to these groups in comparison or when kept in access to all these strains, that is. But that also risk is one to 3 lakh. You have more chances of being hit by lightning than actually get the blood clotting that is so being talked about right now. Next up, symptoms, very important. So back then when the India strain was there in the country, we had symptoms like fever, muscle pain, loss of smell and taste, a dry persistent cough. Cut to now, in the presence of these strains, in addition to this, you have conjunctivitis being reported more and more. You've got sore throat, headache, rashes coming out is a major symptom this time around, upset stomach, and like loss of smell and taste was a major giveaway last time around, this time discoloration in your nails and your fingers is also being seen as a major symptom that is emerging out of these new strains. Also, another thing to worry about when it comes to those new strains this year around is the early detection. Now, what was happening earlier was the 2020 strain, the India strain culture would show up in an infection or show up in RT-PCR test in about 3 days. So at the time at which you contract the virus, if you get yourself tested, RT-PCR tested 3 days later, it would show in the test. But that's something not happening this time around. And why is that? Because the UK strain particularly is jumping one of the parameters on which the RT-PCR testing is done. I'm not going to get into the details because it will get a little confusing for you all, but there are 3 parameters on which they are tested, 3 strains on which they are tested, 3 cells in a way, and the UK variant ends up jumping one of the 3. So people who contract the UK strain are having to take the test multiple times but still coming negative when they actually have contracted the virus. So what do you do in that case? So what you have to do is you have to ensure that you keep a tab on all the symptoms we spoke about earlier, keep your doctor in loop, and obviously keep your oxygen levels checked all the time. What you can also do is the last point that I'm going to share with you is your CT scan. What's happening this time around is CT scans. Remember earlier things were getting really worse. So back in 2020 when the India strain was the only thing in the country, we would say that if a patient had to get worse, they would begin deteriorating or the situation would worsen in the 2nd week, roughly around the 10th or the 12th day. Cut to now, when those lung patches are being seen in the CT scan much earlier, in the 1st week itself. So if you put the last 2 points together, you might still be testing negative, but if you get a CT scan done, then it is going to show that there are patches there. However, this is not to say that you should rush and just keep getting CT scans all the time. Again, like I said, follow the advice of your doctor, ensure that he's in loop, follow and look out for the symptoms that I've spoken about as well. We clearly are, there is really no two way of saying this, in middle of a healthcare emergency in the country. And this information, I hope, will help you make informed choices for yourself and for your family and loved ones as well. That's it on today's video. Hi there, I'm Sonal Mehrotra Kapoor. You're watching me on NDTV. Now, for the past couple of days, one of the constant queries we've heard from you, the viewer, has been that a lot of people are now testing RT-PCR negative while they continue to have symptoms which are all of COVID. You've written to me about it. I have had family members who've gone through this as well. So I thought, let's do a video where we try and understand, firstly, why this is happening, and second, if this is happening to you, your family or your friends, what is it that you can do? Okay? So first up, RT-PCR is still the gold standard for testing for COVID across the country, and one must continue to rely on it. However, more and more data is now emerging that 1 in 5 people who are testing for RT-PCR, their results are coming either false positive or false negative. Why is that happening? Because currently, remember, there is a cocktail of new mutants which is out in every state in the country. And these testing kits for RT-PCRs were actually built much earlier. A lot of them are not updated to the latest variants in the country and thus are not catching on to it. There are various new kits as well that's already out in the market there are few states who are still using the old ones, and that's why this is happening. In particular, the UK variant, the extremely notorious UK variant, which is also part of the double mutation, remember, we've talked about this in the previous video, they are in particular jumping the test. They're not reflecting in the test, so you have to be careful. Number 2 reason is there might be a possibility that your virus load is actually very low, and that's the reason why it's not reflecting in your test. Number 3, and this is the harsh reality really of where we are living in, the testing load in the country is so huge that our testing quality is being compromised, and that is seeing a deterioration. For example, we just reported a couple of days ago on how a gardener in a hospital once was asked to pick up samples from people because there was simply nobody else left. Our healthcare infrastructure is so extremely burdened that now we are looking into other avenues. There are some attempts to sort of meet all these gaps, and that is leading to a compromised way of testing. So if you are also facing all of this and you have symptoms for COVID and symptoms which are emerging out of the new variants more and more, but you are still testing negative, what should you do? First up, if you have come in touch with anybody who's tested positive, isolate yourself immediately. That is the key. Isolate yourself, and the first thing you need to do is watch out for your symptoms. I've done a video on this talking about all the new symptoms. Go back to that video, see the list, educate yourself, keep yourself informed. If you are reporting any of the symptoms despite testing negative, stay in isolation, inform your doctor. Let him know about your symptoms. He will in all probability start with your medication. Next, keep an oximeter handy. An oximeter, all of us know about it now. Get it from a nearest chemist or just order online and start noting your oxygen levels at least twice a day. And if at any time your oxygen level goes below 94, you need to report to your doctor. It is a matter of concern. Next, if both these things are also fine, but still your symptoms are there, you need to repeat your RT-PCR test in the next 3 days. Then, if it's still negative, you have to undergo a CT scan. A CT scan should be done, I want to underline here, only at the advice of your doctor. And if he says so, please go get it done. Remember, in the second wave already we are seeing the CT scan, the patches are seeing in the lungs much earlier. They are being witnessed in the first week itself compared to cropping up on the 8th or the 10th day compared to the first wave. So those results will also come up on the CT scan. Apart from that, there is one more thing you can do, which is not much talked about, but here's a tip. You can also get your blood test done. A blood test at times also shows in various forms of inflammation in your body and gives your doctor a good idea about what's going on. And there are 2 blood tests that you can get done. Please note that now. The C-reactive protein and the D-dimer. Get these tests done, take the results to your doctor and let him figure out what is to be done next. The reason why this is so important is because I understand it happened in my family as well. We had people who were showing all the symptoms but constantly one test after the other coming out negative. And if they got serious, if they had to be taken to a hospital, no hospital would admit them because they don't have a RT-PCR positive. So this is some information I hope will come handy to you. Like I said, so far, still RT-PCR is the best way to go. So you have to repeat those tests, but also watch out for symptoms. That is the key. So keep that in mind. I hope this was helpful. We'll see you again in the next video. Bye for now.